Good afternoon, everyone. Welcome to the Lunch and Learn session today on secure messaging and HealthLink smartphones. My name is Priyanka, and I am the Allied Health Integrations Program Officer here at CESPHN. Joining us today from the PHN is Lauren, who is the CPD Program Officer. And I would also like to welcome our guest speaker, Dara from HealthLink. For those who are new to digital health and secure messaging, HealthLink is one of the secure messaging providers used by the clinicians in our region. I would like to start by acknowledging the traditional custodians and sovereign people of the land across which we work. I recognize their continuing connection with land, water, and community, and pay my respects to elders past, present, and emerging. I would also like to extend that respect to any Aboriginal colleagues joining us today. Just a little bit of housekeeping. Today, we're going to use the chat function to ask any questions. And also, this webinar will be recorded and an evaluation survey link will pop up on your screens at the end of the session. Here are some upcoming events. If you like to register for any of these, you can find these on the CESPHN website. So let's get started. So before starting with HealthLink smartphones, I'll just go over the concept of secure messaging, how it works, and the benefits of using secure messaging. So what is secure messaging? Secure messaging in a nutshell is the safe, seamless point-to-point delivery of messages. It enables the healthcare professionals to securely exchange confidential clinical information through an encrypted system. The sensitive data is protected during transmission and can only be accessed by the intended recipient. These electronic correspondence can include pathology and radiology reports, discharge summaries, and referrals. So how does secure messaging work? So secure messaging delivery basically includes 4 steps. First of all, the sender creates a message that is encrypted. That message is then transmitted via the sender's secure messaging provider to the receiver's secure messaging provider. And once the receiver's secure messaging provider receives the message, it is then decrypted by the system and delivered to the intended practitioner, and the sender is notified of the successful delivery. So the benefits of secure messaging, first and foremost, is the confidentiality and integrity. Because the messages are encrypted, it reduces the risk of unauthorized access or data breaches. Timeliness, it's as easy as sending an email, and you don't have to go through the process of scanning, printing, and faxing. Automated system notification confirms the delivery, thereby streamlining the workflow and providing an audit trail for communication. It's environmentally friendly and reduces the reliance on paper-based communication, and you can get access to a broad range of referring clinicians. So specific benefits for allied health. For busy practices, it can be an absolute mission to check all the pathology and radiology logins. And by using secure messaging, you can direct all those incoming reports to one online portal. And many GPs, because most of the GPs in our region are using secure messaging, so it's easier for them to refer to allied health that are using secure messaging. And sometimes they do prefer to get the reports via secure messaging. So these are some of the secure messaging providers. So the only issue right now we have is the lack of interoperability, which means that the sender and the recipient must be using the same secure messaging system to be able to communicate. But like currently, Australian Digital Health Agency and all the vendors are working towards the interoperability. So that's all from me. Handing it over to you, Dara.
Thanks, Priyanka. You've covered that really well.
Thank you.
I'll see what I can add to this. So firstly, I'll just try and share my screen.
Yeah,
so
sure.
just a moment. Yes. Okay, and I'm just hoping that you're able to see my PowerPoint.
Yep.
Sorry. Sorry, I may just have to leave it on this so I can have my notes to run by. But thank you. I'd also like to begin with acknowledgement to country. I acknowledge the Gadigal of the Eora Nation, the traditional custodians of this land, and pay my respects to the elders, both past and present. Thank you for coming to this briefing. I appreciate you making this time and hope you have a little lunch on the side. And also we've had to move the date, so sorry about that. Thanks to Priyanka and Lauren for organising this session and inviting HealthLink to come and present. My name is Dara Nou. I am an account manager at HealthLink, and I support a wide-ranging number of customers from laboratory, radiology to hospitals, health associations, whether they be sending or receiving secure messages. So what I'll be covering today is I'm going to presume that you don't know much about HealthLink and start with where did it all start, what are we trying to do, and what have we achieved to date. And I'll try and cater this so that it's a bit more informative for our allied health members, so that you understand what you can get out of HealthLink and how we can support allied health members. So let's move to the first slide. And I just wanted to show you very quickly a very quick timeline here, and to condense it. HealthLink began in 1990, and it started in New Zealand. It was just an idea by our I say founding fathers, but the founding members, and it was the basic delivery of pathology reports to 100 GP sites, and that was in the 1990s. By 2000, it was the largest private network in New Zealand, and additionally delivering RSDs, so that's discharge summaries and specialist letters. And to mark this moment, also around 2001, HealthLink entered the Australian market, starting with the Gold Coast medical imaging, so sending reports for this radiology. And we also then sent pathology results for WA. We worked hard. So by 2006, we had 5,000 registered sites around the AU network. And going back to New Zealand, the first hospital referrals began in Hutt Valley, and this hospital referral project slowly rolled out, but steadily in New Zealand. So coming closer to our present day in 2016, we saw Victorian hospitals then begin their electronic referral process and roll that out around the same time as New South Wales rolling out their RMS fitness to drive forms. So you can see that in that, I mean, what we consider a fairly short period of time, we were able to endeavour quite a lot. Having a look at our footprint, this is today where what we offer to anybody on our network is the free receiving of messages across our network. So once you register with us, create an account, we provide you with an EDI, you're able to start receiving. How we provide secure messaging to the rest of Australia, or more importantly to New South Wales, not importantly, but to New South Wales, we provide that service to New South Wales Health Pathology, Breast Screen, Metro and Regional Hospitals, sending discharge summaries, admission and appointment notification, and diagnostic reports. So that's on a larger scale. And if we look at just the local health districts, we're doing e-referrals for them. So Sydney LHD, North Sydney LHD and Northern New South Wales are currently receiving referrals, but we're looking to expand that. So we've recently signed a contract with eHealth New South Wales, and we're looking to roll in, I think, around 12 more LHDs and taking care of the referral process for them. Right across Australia, we have on our HealthLink network, we're connecting more than 18,000 sites for GPs, specialists and allied health members to communicate with each other. In New South Wales, looking specifically, we have over 7,200 sites, and the breakup of that is 38% for GPs, 22% for allied health, and 39% for specialists. I'm sorry, I don't know if there's any questions, but let me, if Priyanka and Lauren can let me know if any questions pop up, feel free to type in a question and I'll answer as we go along. I thought I'd include just a picture to show how we are spread across Australia. So, of course, in the cities, in the main capital cities, we have a lot of practitioners signed up with us, but we are right across Australia to help you send and receive. Then if we zone in into our Sydney area, so it's extending as far as Blaxland, there's little real estate left. Each of these red markers is an indication of an EDI, so a practice that's connected to our network. What does being on our network mean? It means that as an allied health professional or service provider, you are connected to everyone else. Now, this image that I have here, or this diagram, is a bit GP centric, but the idea is the same. Once you're in our network, you're able to send and receive to all the other endpoints on our network. So if you'd like to think of it, we're the digital version of Australia Post, and we form a fairly big part of the e-health ecosystem in Australia. I thought I'd also include a slide to show what types of messages fly around on our network, and in particular to allied health. I think that you'd be interested in receiving a referral and perhaps sending information to a GP to give them an update on a patient or a client. But this is just a list of what you can receive and what you can send, being an endpoint on the HealthLink network. So why do we need secure messaging? So there's quite a few reasons. There is the compliance on a federal level to comply to law. And we also have the health insurance schemes, Medicare, that we need to comply with. If we don't play with them, they won't accept our referrals. We have hospitals that also have very high security policies in place that we need to adhere to. And really, we're all working together with one goal in mind, and that is to ensure that patient information is securely transmitted, and that we're protecting ourselves from malicious intent. As Priyanka had mentioned before, we're working towards interoperability. And so with secure messaging, we can help gatekeep that a little bit. HealthLink is we endorse, or we suggest that HL7 messages be sent around on our network. And what that means that when we're working with hospitals or vendors, different software providers, we're all talking the same language. When we wrap that message up in an HL7 format, that can be received at any other receiving end, and we don't need to be too concerned about how that message is going to be displayed or rendered at the receiving end. I might skip the next few slides because these are more around the smart forms, and it's geared a little bit more towards GPs. So I'll just move ahead to what matters to allied health practitioners. So I think, and let me know if there's anything else you need to know, but from a HealthLink perspective, you'd like to know whether you can, whether you need to send or receive. I think that is entirely up to your practice and your needs, whether you feel you need to send a message to a GP or specialist. I understand that current practice, there may be some service providers who are sending information via email or even WhatsApp. And of course, we don't condone that, because although they say that they have end-to-end encryption, they're not within the healthcare sector. So whereas we are within the health industry, and so our perspective on how we secure patient information is quite different to what a social media would consider. So if you consider that you do need to, or you would like to send or receive via HealthLink, the first thing that you'd want to do is register with HealthLink so that you receive an account. And with that account, you're provisioned an EDI. So that EDI is a code. Usually we take the first few letters of your practice name or whatever it is that you might like to include. And that becomes your address. So other GPs, allied health services, specialists can locate you by that code. Now, if you're lucky enough to have a software that is integrated with HealthLink, that's great. It just means that you don't need to do much more other than to configure your EDI into your software management, practice management software, and you'll be able to receive immediately. But if you're not able to, because not many software for allied health integrated with HealthLink, and I'll come back to that in a moment. You could have the alternative, which is to use a portal, and we have two types of portals. One portal, which is called My HealthLink portal, is just a portal for you to receive messages in and send smart forms. So it has smart form capability, meaning you can send a referral to a hospital or to a community health. But that depends on whether that hospital has a referral set up or not. So you can't just send to refer a client to a hospital that hasn't set it up with us. The other option is to connect with, have a portal with HL Connect. This is software, it's a portal software that we run in conjunction with MediNexus, and this allows you to send messages. So the big difference between My HealthLink portal and MediNexus Health HL Connect is that HL Connect allows you to send a report or a letter to a specialist or to a GP. You can't do that with portal, but you can send a smart form via My HealthLink. If you need any more clarification on that, let me know, and I'll have a chat to you afterwards. The other provision is the provider directory, and that allows you to look up all the other EDIs on our network. So that's very helpful for, say, a laboratory or radiology clinic who's looking for you or looking for a GP. They will search by your practice name, locate your EDI, and then they're able to send a report to that EDI. So whilst it's free to receive via HealthLink, there is a cost associated with sending a report. And if you are sending via a PMS that's integrated with HealthLink, then your subscription for the month will be $12, and then it's 15 cents per message. For the most part, allied health members would use HL Connect portal, and that has a different service schedule set up. So we're looking at a full-time employee paying $36 a month. So that's sort of a subscription fee. And that includes 400 messages. And again, it's 15 cents per message to send. The PTE, part-time employee, is for sites where they may only open a few days a week, or an employee who only comes a few times a week. So that schedule allows you 200 messages a month at $18, so half rate, 15 cents per message. So I thought I'd also include some information about how HealthLink supports you. And the help desk helps with technical issues. There's a registration desk who is more on your EDI. Perhaps you need to move practice or you need to alias it. But we also have a dedicated few staff who are software specific. And so they give you more tailored help when it comes to a particular software. But for most of the time, we'd be supporting the Genie space. So if you happen to be using Genie software, We have the specialist group who support that. And with the allied health, I don't know that we have any particular software that we support, but do come and speak to us, because we can certainly brush up our skills and knowledge and go and speak to that software provider and exchange information. That's probably the best way to support you. If you engage us with your software provider, then we can have those ongoing meaningful conversations to see what sort of technical support you need in the long run. So the other question that I'm asked often is whether allied health can receive referrals, and the answer is yes, definitely. The most common way to receive the referrals, a GP referring to an allied health member, is via their PMS, and it's usually best practice or medical director, which have an inbuilt function called letter writer. And when they start that function up, it just creates a very basic Word template, a document, and the doctor will need to fill out everything. So it's just a letter writer. But once they've completed the letter, they then look through the address book. And if you happen to be on the network, on the HealthLink network, then they'll look for your EDI, attach that EDI to the letter, hit submit, and that will be sent to your EDI. Of course, how you receive that information could either be via your PMS, your software, or you may be receiving it via HL Connect or My HealthLink portal. The one point that I wanted to make, and I guess it's for something to keep an eye out for, is that we are going to be updating our My HealthLink portal, and that means that it's going to be able to send one day. So hopefully allied health members will sign up with My Health. Sorry, I keep getting this wrong, with HealthLink portal, and we'll be able to send a message for you. So that's coming up. We're hoping that will be launched next year. So that means that you won't have to sign up with HL Connect. You just need to join My HealthLink portal, and you'll be able to send and receive from the one location. So keep an eye out for this space. So I thought I'd include our website. I'll send a package out to everyone who's attended today, so that you have a link to our website, some more information there as you need it. Our contact number, 1-800-125-036. Of course, that's if you're on our network. You can press 1 for help desk and 3 for that specialist support for specialists in allied health. And if you needed to reach out for non-urgent matters, you can use any of these email addresses with your queries. And I certainly want to hear from you. Please reach out to me, because I feel as though with the allied health space, we could do better. I think that the main difficulty that we've had is around the software vendor integration. There's a lot of software that isn't necessarily clinical software. A lot of the other software is is a case management type software, and we find it difficult to integrate with because it doesn't always support the HL7 messaging capability. If you're really determined to have it connected, come speak to me. I will then engage our vendor integration team to have a chat to the software provider, and hopefully they are happy to sign up with us and go through our message testing and compliance, and make it easier for you to send and receive from your own practice management software. That's it from me. I just wonder if there's any questions here.
Sorry for interrupting, Dara. Are we please able to go through the HealthLink smart forms, the fitness to try ones? Because that's what majority of the allied health provider will be using. Yes, please.
Okay.
Thank you. Thank you.
What I'll do is I'll just log into my UAT account. So this is my test environment. And I will bring up the New South Wales Fitness to Drive. Okay. So I'm assuming you can see the form on my screen
Yeah.
here. Just try and make it a little bit bigger. So in this form, I think I would like to know if what the main challenges in filling this form out are. I think that we're in my last conference, I know that there was some concerns around how the other, say an optometrist would need to submit a form and how that matches up with a particular patient driver. And that is all done at the transport end, at RMS's end. So that's all based on the license number. They match up all the different forms that we send to them to see a complete profile for a customer. I think that's where a lot of the doctors have paused because they didn't know what to do with a form. They were parking it, but they were waiting, thinking that they needed to wait for for another assessor to send in their form, and that was holding up the process. For GPs, there are ways to get around that, meaning that you can submit your part of the form without having to wait for another assessor to complete their form. RMS will be able to put all of that together and complete the profile. So I think I would have to go through and use a sample patient. I that information up. Sorry, everyone. I might just might have a bit of trouble with this one because I'm in my UAT environment and I may not have the correct information here. Okay. Sorry for the wait. I've just picked out a test. So we'll put in a date of birth of 08/10/73. So again, this is all test information, not real at all. So I'm hoping that you're all familiar with this part of the process, which is just to fill out the information. Now, this is usually done a lot quicker through a PMS because the information would automatically populate most of the form. There would be no need for me to enter in patient information, but because this is my portal account, I do need to enter in all the information. 16. Okay, hoping that that will pass. Okay, I'm very lucky. First entry, first go. Okay, so is it fitness to drive assessment that we're looking at? Yeah. So clicking on this form, I will just make it a little bit bigger for myself. This is the information that everyone must read and then accept. And here with a medical assessment. So again, we do need to enter in the information again. From a PMS, most of the information would be pre-populated. I think here, I'll just add in the information one more time. So the idea with this is that there's validation that needs to happen. Once I've popped in the driver's license number, I click on validate. And here, the information that is pulled across is coming from Transport for New South Wales. If there's any error or problems with this, I do recommend calling and contacting the Transport for New South Wales, because it's very particular. The information that comes in here needs to match records specifically. So it can be a little bit finicky at this point in time. So I don't recall having many GPs convey this to me, saying that they've had difficulty in validating their patients, but it may take a few goes to get it right. So to continue with the medical assessment, now here there are there's been feedback around when a doctor or a GP clicks on yes, they're required to fill out quite a lot of information. And there's certain parts of the form where it requires the doctor to go and review, say, a report from an optometrist. When that happens, there's the ability to park the form. So I would recommend for most of the form to be filled out. When you park the form, it'll park it and save it into the patient's file, or in a portal setting, it will just save it into, I won't click into it, but it'll park into the drafts folder. So there's a folder that you can click in there. And once you go back in there, you can reopen any existing form and continue with it. I think that's been a bit of a challenge for GPs or specialists to do. My recommendation is just to park the form when in doubt, and then you can give us a call if you needed any more help. I think here, Priyanka, is there anything specific that you would like me to go through? Because it's fairly straightforward in what the GPs and specialists need to do to fill out the form.
Yes. Do we have the one like the occupational therapist and the optometrist one? So just like briefly need to go over that.
So this one here. So
yeah.
same idea here. Yep. Click on continue once you reviewed. Go through the driver's license number again. I'll pop in on patient consent first and then validate the record. Check that everything is correct. If that's okay, click on continue medical assessment. Oh, field of practice, sorry. I'm just looking for a, there it is. Okay, so say if we are an optometrist, does the patient have current vision or eye disorder? Yes, no, pick. Then the accordion selection will reveal other tick boxes that we need to select. So say if we select that. Patient's visual acuity, again, we'll just add in the information as necessary. Taking note that anytime you see an asterisk here, that's a mandatory field, so it will require your input. Does the patient meet the vision standard? So again, just filling out the information as we go. First visit, yes. August. I'll just fill out as little as I can so I can try and get to the end here. So it does, yeah, there's quite a number of questions that we need to complete here. I'll add some information. Added more information. And importantly, to applicant declaration, this needs to be mentioned to your patient as that declaration. So I'll see if I can try and submit this. Now, with the attachments and reports, through here, you can add in any relevant information. Now, this will go through and look for files on your local drive. So in this case, I can add in a photo perhaps and upload that. And there it is. It'll show me that that's been attached with a little tick. If I choose not to attach that file, then I simply untick it and that will disappear. Patient information, again, this is information that is usually drawn from the PMS, but in this case for the Transport for New South Wales, it has taken some of the information that I've entered in the first page and transferred it to this one. Again, I would just check and make sure that the information is correct before sending it through. The recipient referrer tab, this is my information as a referrer. Usually it'll require me to enter in a provider number. So just add in a provider number. And if that is all correct and I'm okay with the information, I can firstly preview it. The preview will let me know if there's any errors, and there is. So I need to go and fix the error. Did you have any knowledge of the patient's medical history before undertaking? So let me go and find that. I need to, so it's highlighted in red. I'll just click no. Preview one more time. So if it gives me a preview, it means that I have satisfied the minimum criteria for this form. This is essentially what it looks like when it lands in Transport for New South Wales as a PDF. Now, they have done more work on their end to receive this information atomically. It goes directly into their system. But when we look at it as a PDF version of it, this is how it's displayed or how it's rendered on our end. One more check to have a look and make sure that everything's okay. Sorry, this screen is a little bit condensed for me, so you probably won't see everything here. If everything looks okay, I can scroll back up to the top and I will hit submit. And there it is attempting to submit. And it seems to have done it. And again, just reminding you that this is my test environment. It's letting me know that the form has been sent at this time. There is I'm looking for a reference number, which pops up. Let me see if I can find that. Maybe recorded, sorry, here's the referral number. That referral number is useful to HealthLink. So if you call up HealthLink help desk and say, I had trouble with this referral, was it sent? Quoting this RMS 14809, of course it's different every referral, will help us to track this referral in our system. Now, if this referral did not submit successfully to RMS, then we would have to track this referral in your PMS or in your portal account because simply because it hasn't sent. But we'll be able to work out with the referrer what the errors are and then perhaps get you to fill out the form and try and submit it one more time. Now, if I look into my sent folders, submitted items, this referral will be in there. And there it is, RMS 14809, telling me that it has been acknowledged by the other end, the time that it was sent successfully. And sorry, I just clicked on that. I accidentally opened that, sorry, and telling me what that form was, which one it was. I think, is there anything else, Priyanka, just to remind me if you wanted me to go over anything else?
No, I think that's all. Yeah.
Yeah, thanks for reminding me. That's probably a good
Okay.
demo, a little bit wonky, but I hope I got the message across.
All good.
Are there
So
any
that's-
questions?
yeah. Any questions, any comments? Lauren, do you have any questions in the chat box?
No, we don't currently.
No. Okay. Oh, it must be straightforward then.
Well, good. Thanks so much, Dara, for your time and effort in delivering this session. It was very informative. And thank you, everyone, for joining us today. And if you have any questions after the webinar, feel free to send me an email or shoot a text. My contact details will be on the slides that you'll receive after the webinar. And thank you once again for joining us, and have a great day. Thanks, Dara.
Thank you.
Thanks,
Thank you.
Lauren. Thank you.
Bye.